Hi, welcome to Iron's Health Talk with Dr. Akram. Today we are going to talk about vitamin D, which is a hot topic at the moment. Let's look at what is this vitamin D. Vitamin D insufficiency affects almost 50% of the population worldwide. An estimated 1 billion people worldwide across all ethnicities and age groups have a vitamin D deficiency. This pandemic of hypovitaminosis D can mainly be attributed to lifestyle, for example, reduced outdoor activities and environmental factors such as air pollution, which both reduce exposure to sunlight. Current studies suggest that we may need more vitamin D than presently recommended to prevent chronic disease. Why is this vitamin so important to us? Because it is implicated in almost everything your body does and controls, such as bone health, cancer, cardiovascular disease, immune system like infectious disease, autoimmune disease, and inflammatory bowel disease. Not only that, it even involved with diabetes, depression, dementia, pregnancy, weight loss, chronic pain. That's a lot. Now, we know that vitamin D is important for many health conditions, and we know that it has confirmed that benefit in treating rickets in the early 20th century. But over the years, more knowledge has been gathered about this vitamin. Even though vitamin D has been generating interest for generations, with the current infection of COVID-19, the importance of vitamin D has become a big topic. It is a big topic now. First of all, is it a vitamin or a hormone? What are the benefits? What are the side effects? Can we take it safely? We will be discussing all these issues today. Let's welcome our special guest to talk about this. Please welcome Dr. Suboda Thanthulage, MD, FRCA, FFP-MRCA, FIPP. Dr. Thanthulage has been a consultant in pain medicine and anesthetics at Broomfield Hospital, UK since March 2009. He is the local pain medicine educational supervisor at the Broomfield Hospital. He completed specialist training in anesthetics and fellowships in pain management at Bartson, the London School of Anesthesia. He obtained the fellowship in pain medicine. Now he's been practicing in Broomfield Hospital for about 11 years. Is that right?
That's correct.
Anyway, Suboda, welcome on our show.
Thank you very much, Akram.
It's a pleasure to have you here.
Privilege, and thank you very much for inviting for your program. It's a very important topic, at least in my view, which we are going to talk today.
Excellent. Okay, guys, this is a live program, so please call us on 020-35-155-788. That will be on our channel, and you can also watch us Facebook Live and send us questions through Facebook, and you can write your request and suggestion to healthtalk@iron.co.uk. Okay, let's jump to our program. Good. It's quite interesting. I've been reading about your profile. You have studied in Russia.
That's right.
How come you ended up in UK, and what was going on here in this?
It was a long journey for me. Obviously, I was lucky enough to have a scholarship and go to study my medicine in Russia. I never regret being in Russia. I have been in all over Europe during that time, accumulated a lot of interest and a lot of details of social activities during that time. Following completion of my medical degree, obviously I work in Sri Lanka, and I did my postgraduate studies.
So you worked in Sri Lanka after you finishing your medical school in Russia. Okay, that's quite interesting.
So I worked there for a substantial amount of time, and subsequently I moved to UK in 2002. Since 2002, I have been here in UK. Currently, I am practicing at Broomfield Hospital since 2009, since I have become a consultant in pain medicine and anesthesia. So one of my main interests is investigating and helping patients to manage their pain, and vitamin D is helping me to do that quite a lot.
Okay, that's quite interesting. You are a pain consultant, right?
That's correct.
From my knowledge, I've been an anesthetist. Pain and vitamin D is so far for me. But you are a consultant in pain management anesthesia. Why do you have interest in vitamin D? How does it come?
Now, when you think about vitamin D, think about a patient. As a pain doctor, my job is looking at the patient as a whole system, patient as a whole. And if you don't treat patient holistically, you can't be a good pain doctor. So if you think about the patients who come to the hospital or come to any of the doctors, they have some discomfort and pain. And some of these patients get treated and get rid of their pain. Some of these patients get treatment but unfortunately end up in having pain. My job is to find out how we can help them to improve their quality of life and pain. Now if you think about vitamin D, you have nicely elaborated that vitamin D is helping every aspect of your life and disease. Now, if that is the case, if vitamin D is improving your function, if it is improving your mood, if it is helping your disease, by advising and treating appropriately with vitamin D, I might be helping them to get rid of some of the disabilities which causes for their disease. And also in my practice, I do this for a long time now, and I have been discharged patients sometimes only with vitamin D, especially young adults.
So you had patients who came for their pain treatment to you, and you have prescribed them vitamin D, and you have discharged them on vitamin D at some time, even without any other painkillers. Is that right?
That's very correct. Now, when we look at the pain, when the patient comes, all what we want is to find the cause for the pain. Sometimes we fail, we can't find a cause for the pain, but we need to give an answer for them. Now, when you start vitamin D, what I say, at least some of them get better with the vitamin D tablets. Obviously, it is not a magic bullet. It is only one of the important hormones in your body. By introducing
So you said it's a hormone. Anyway, we'll go to the topic a bit later, but yeah, keep continuing.
Now, and the other thing is, some patients, it may not improve their pain, but it improves their quality of life.
Improve the quality of life.
And also, I might finding very easier to manage and help in their pain. Sometimes medication which was not responding before, they start responding to the medications.
After you were given vitamin D.
That's correct. So combination of many things, what we do in the pain clinic. One of the major importance for me is to prescribe vitamin D as well if I find them low in vitamin D. And that helps me to help them without medication and with the medication. And also we need to understand some of our patients, they have been trying so many medications without any benefits, but they produce loads of side effects. But on the other hand, trying vitamin D, there is no harm, it is natural, there is no side effects. And it gives loads of benefits. Okay. Why don't you try it?
A quick question. This one I've been thinking about for a while. Does it anything or any patient or any event or any talk or something which triggered for you to investigate into this vitamin D? You've been researching about vitamin D for about 11 years. Is that right?
That's
is
a good question.
Anything where I started?
This is a very good question where I started. Obviously, as I became a pain consultant, I want the patient to get rid of their pain. But obviously in that quest, I was trying to find out what source of medicine, what sort of treatment is there for me to help my patients. So obviously Google is a fantastic site where I found vitamin D possibility a reason for some type of pain. And on my very first patient who I have investigated, in November 2009, I found vitamin D was extremely low.
So November 2009, your first patient in your chronic pain clinic.
That's correct.
And you found this patient and whose vitamin D was low.
And on that
That's amazing.
On that day on, I have been investigating and helping them patient with vitamin D, and I have found amazing results with them which make me really happy.
That's quite amazing. You have this determination for 11 years. You are still continuing with vitamin D, and you are still persistent, and you want to give people vitamin D. Even I have taken your advice about 10 years ago. I'm going to talk a little bit later about that. Okay, let's see. Why are we low in vitamin D?
Now, when you think about vitamin D, you nicely elaborated, as I said before, how it's produced. In human, 95% of the required vitamin D is coming from sunshine. It's not actually produced in sunshine. Vitamin D produced in your skin.
So 95% of the vitamin D is coming from sunshine.
Sunshine.
But the vitamin D is not coming from sunshine.
That's correct. Now, unless otherwise you don't take the supplements.
No, I'm asking the vitamin D itself is not coming from sunlight.
No, very correct. Now, how vitamin D produced in the skin? Now, we produce cholesterol in our body. On the way to produce cholesterol,
that's the same cholesterol, I suppose.
That's the
which
same
affects our
cholesterol.
heart.
Just before we produce real cholesterol, few steps before that, this cholesterol is produced from any of our cells, muscles. 80% of the cholesterol in the body produced by our body. It's about 20% of cholesterol we take from outside to inside.
That's interesting.
Now, these cholesterol will deliver in surface onto the skin, and it is there which is called 7-dehydroxy cholesterol, and waiting your skin to be exposed to sunshine.
So this cholesterol waits there and wait for you to go and lay down in Bournemouth Beach and get that proper sunlight, yeah?
And even these days, today in the morning, your garden would have been better because there's a lot of
sunshine.
sunshine.
I forgot about the garden. Okay, let's go ahead. That's interesting.
And what it does is when your skin is exposed to sunshine, it has to be direct exposure. You can't have a sun factor. Sun should not come in through the glass. When the sun comes through the glass, it filters out all the ultraviolet lights. Now the range is ultraviolet B range, which is 280 to 350 nanometer wavelength. When it touches the skin, what happens is these cholesterol converted into pre-vitamin D3. When it goes to pre-vitamin D3, it stays there again until it converts to vitamin D3. It to be converted, skin has to be warm. So if you go into the sunbathing, very cold environment, your vitamin D may not produce and even not perfuse back to the circulation.
So in the winter, if we lay down in our glass house sunbathing, we might not get enough vitamin D.
You may not get this vital vitamin. We call it vitamin, it's actually hormone. Now, we call it hormone because it's produced in the skin. Anything we produce in our body, it is a hormone. And it has a hormonal activity. Anything we take from outside, any microelement could be a vitamin. Now, what happens is once you produce these pre-vitamin D3 and then transfer into vitamin D, it comes to the circulation. And this vitamin will circulate in your blood about 1 to 2 days.
1 to 2 days.
That because this is very fat soluble. Depending on how much fat you have, it goes into the fat. Unless your fat saturate reasonably good level, it might never come back to your circulation.
I have a lot of fat around my tummy. Will I have a lot of
Definitely
vitamin D around there?
Now,
okay.
it's when it need to come back, it's only happen due to concentration gradient.
Okay.
But because it is very much fat soluble, it sits there, and you can have loads of vitamins in the fat without coming back into the circulation. Now, so one is in the circulation. To be active at the next phase, it need to go through the liver. Now, when it goes through the liver, it becomes 25-hydroxy vitamin D, which is the next step of converting vitamin D.
So that is still not fully active in this stage.
It's not fully active. And this form of vitamin D is equally distributed in your body. So this form of vitamin D can last for at least about 2 to 6 weeks in your blood. And it's equally distributed in your whole compartment of your body tissues. It could be equally fat, muscles, any tissues, it equally distributed.
That must be the reason we measure these vitamin D.
That's why we measure these
levels.
vitamin to reflect the level of our body vitamin
interesting.
D. And then it to give the benefit, it need to either go through the kidneys to convert the next step, which called calcitriol or 125-dihydroxy vitamin D3. Now, that is the form, activated form, which does all the purpose and all the activities in our body. Now, even though I said it need to go through the kidneys, but the vitamin D or the 25-hydroxy vitamin D does not need to go through the kidney to be activated. It activates every single cell levels, but most of the activation happen in the kidneys.
In the kidneys.
In the kidneys.
So, okay, generally we get sunlight, you got ultraviolet light, and which hits our skin. The cholesterol get activated. It becomes somehow it forms this vitamin D3. Then it been transported through the blood system to the liver, and it get activated. Certain amount of activation,
yes.
Then it has to go to the next level of the organ, so, the thyroid gland.
It's a two-step process. Now, two-way step process, that means first at the liver it converts to one step close to being active.
Okay.
And the next step when it's going through the kidneys, and the next activation process happen.
Now we have active vitamin D.
Active vitamin D3, yes.
Okay. Let's go. Why are we low in vitamin D?
Now, as we elaborated, as you discussed the conversation in the first, now if you look at me and yourself, and in a normal lifestyle today, we need to get into this suit or close to this amount and jump into your car, go to your office, do your work and come back. If it's a sunny day like this, if I start at 7 a.m. and if I come back at 6 p.m. and once after my work, what I do, I may do my home chores, or I may sit in front of the TV or read the paper, and I have no time of exposing my skin to the sun. And if I think, because I have my palms open and the face is open, and if I go on the sunshine, it does not have enough skin surface to produce vitamin D.
Okay.
And on top of that, if you think about the ladies, if they do some facials, or if you put any colors on your skin, it will stop producing your vitamin D. And
so that's quite important for Asian people, isn't it? They wear they're fully clothed and they wear lots of makeups and everything. They go around, so they might still not produce enough vitamin D, even though they walk
That's
in
very
the
correct.
sun.
Now, if you look at the different countries, even which close to the equator, we all have a low vitamin D. One of the reasons is some people, as a population, in fact, they would like to have a fair skin.
That's true.
And the other thing is, and there is a scarcity among the many people about the cancer. Now, all these factors play a part. You do not to expose your skin to sunshine. Mm-hmm. And on top of that, we don't have time.
We don't have time as well.
And everything together, it plays a part us to be low in vitamin D. But on the other hand, when you talk about why Asian populations are low, now the question is...
Yeah, I want to add something here. I mean, I know like Asian people, they all want to have like a lighter tan, and sometimes they use these different creams to make their skin lighter, and they avoid sunlight.
If you put any lotion to protect sunlight penetrating your skin, that will not produce vitamin D.
Vitamin D.
For argument's sake, if you think sun factor, if you put the sunblock, which is 15 to 50%, they have sunblock. If you put 15% sunblock, it produces UV light penetrating into your skin by 93%. So you don't produce much vitamin D. If you put factor 50, you may not produce any vitamin D, or you may not get any benefit of sunshine to produce any vitamin D under your skin. And also, if you look at the skin colors or skin tones, according to dermatology guidelines or criteria, there are 6 tones of the skin.
There are 6 tones of skin.
6 types of
colors.
Now, white British person who has a very, very fair skin, who burn very quickly, they can produce quite fast.
There is a question coming through Facebook. This person is asking how long you have to stay in the sun to produce enough vitamin D. But anyway, I think we are heading the answer is going to that way, isn't it?
That's
so
correct,
okay,
yeah.
Let's go ahead.
So if a person who has a very fair skin, who never get tanned, easily get burned, they can produce within 30 minutes exposing themselves to sunshine 10 to 20,000 international units, depending on how much skin they can expose. Now, ideally,
So that is enough for a week?
Now, usually, if you have one sun exposure to produce that amount of vitamin D, is enough for 1 week.
So if you are really fair skin, you can lay down for half an hour in the right.
That's correct. Right condition. And,
right condition,
and there is a but.
And that's enough for a week.
But even if you have not exposed your skin to the sunshine, you have to be careful because, as I said, very fair person can get burned very easily. That is bad outcome. What they need to find out erythematous dose of sun exposure. What does that mean is, when you expose your skin to sunshine, you may feel hot, burning heat in your skin.
Okay.
And when you feel that, you need to go inside or you put sun factor at that time.
So that's the time. Roughly for white people, if it's half an hour, you feel your skin start burning and you need to go cool down and put sun
this
lotion.
Time, the time duration depend on person to person.
Person to person.
It doesn't matter he is fair or the dark skin. It's something like if you take a plant or a tree from equator, keep in your household for a few months. If you put the plant outside, it will burn easily. So now your skin has not exposed to it at all. If you go outside, there is a chance you can burn. Therefore, if you feel hot skin, before you actually feeling pain, you should come inside and either avoid sunshine at that point, give a little bit of break, or put a sun lotion.
Sun lotion. Okay, there's a quick question coming through, but we're heading that way anyway. For Asian people, how long they have to lay down?
If you have a darker skin, to produce same amount of vitamin, you have to have 4 times of that time.
4 times then
the white fair person.
Fair person.
Now that means at least it will take 2 hours you to produce same amount of vitamin D. But unfortunately, that is the safety factor produced in your skin, which we have a lot of melanin on a brown skin. The melanin is there to absorb dangerous ultraviolet light reaching your skin, because that is one of the processes why people develop skin cancer. So the darker your skin, you have a lot of melanin in your skin, and that melanin give you a safety board or safeguard your skin from sunshine.
From sunshine, because this melanin will absorb this unnecessary or unwanted rays, and it will protect.
Because that skin tend to be in close to the equator. So we have a more intense sunshine. So we don't need that much, or extra amount need to be absorbed.
Right.
But what happened here, when you come to this part of the world, or north or south of the equator, depending on where you go, sun intensity is small. So nevertheless, that melanin will absorb whatever the sunlight which comes to your skin.
Okay, can't we get enough vitamin D through food?
Now, as I said, if you don't get supplementation, almost 99% of the vitamin D comes through the sun exposure.
95% or 99, sorry?
90 to 95%.
90 to 95% comes from sunlight.
Sunlight.
And only about 5% comes from
that
food.
Because if you think about the food, most vitamin D has 2 types of vitamin D. One is called vitamin D2, which contains in vegetables or trees, palm oil, that sort of vitamin.
Palm oil, yeah.
But which is produced in animals, which is called vitamin D3. There is a little structural difference. Now, mostly vitamin D3 contains either in animal food or mainly in fish. It depends on what type of food you consume. If we'll say, argument's sake, a wild salmon. If you have a wild salmon 100 gram, you may get 8 microgram of vitamin D3, which means 400 international units of vitamin D3. If you eat egg, you might get 2 microgram of vitamin D3, which is 80 microgram. And if you eat, argument's sake, sardine, the amount what you take is less than that. That amount of vitamin D, when you look at the papers, it can vary. Obviously, if you have a farm salmon or farm fish, vitamin D containing amount may be much less. But whereas a wild subject may have more vitamin D.
But still, that vitamin D, the 5%, is not enough for us. I think we're going to talk more about all this about vitamin D. I think we need to go for a quick short break, and it is this is Iron's Health Talk with Dr. Akram. Today we're talking about vitamin D. which is really important, especially with this COVID pandemic going on. We are heading that way. We're going to talk more about why is it important, especially during this COVID pandemic. So be with us and be tuned to Sky Channel 782 Iron TV. We'll see you after a short break.